Good morning, everyone. My name is Smita Mehra from the Neem Dental Practice, and today I'm going to talk to you about the importance of diet during a lockdown. Now, before I do speak, I just wanted to give you an update of how the last week's been. I'm sure we all have our own individual experiences of how lockdown has been affecting us. And this week has been a really busy week with emergency calls, actually, which has been quite frustrating, if I'm honest, as I'm taking all of the emergency calls from both of our practices. And I'm finding that as time is passing by, people are starting to experience more and more issues as we would have predicted, but it's just becoming a bit more frustrating for me because we can't physically still see you if there is an issue, and that is extremely frustrating for us dentists because we would like to get involved and see what we can do and get you out of a tight spot. But the issue, as you know, and as I mentioned last week, was that because our profession, we work in very close contact, and so and we do the mainstay of what we do is aerosol generating techniques or treatments. Therefore, we are, I suppose, at most danger. You are most at danger, we are most at danger, and hence why a couple of weeks ago we were told to, well, during lockdown, when that was announced, we were told to stop treating with immediate effect. And so therefore, the advice that I'm giving to a lot of people this week is mostly based around analgesia or pain relief, or temporization of their fillings or whatever might have come out, or if they've got cracked teeth, and just giving them advice, really. So I'm hoping that at some point soon we can get out of this and we can get back to doing what we do best and what we know best, which is treating you. So watch this space, and we will let you know as soon as we are open. In the meantime, I have one of my colleagues calling certain patients who we know are quite vulnerable because of various treatments that they've had, and touching base, really. And if you do have any issues or any problems that you just want to talk to us about, just call our regular practice numbers, and one of us will be there to speak to you or to help you with any issues dentally related that you might have. Okay, so on to today's topic. It's very exciting. We're going to be talking about the importance of diet and oral health. I mean, we talk about it in a lockdown, but actually, I'm going to be talking to you about just the general importance of various items within your diet and various vitamins and nutrients, etc. And yes, of course, it's even more important during lockdown because we are more in control of what we put inside our bodies during lockdown, since we don't go to restaurants where we can check the ingredients, and and even shopping that often where we can check the ingredients. So I suppose this will make it more important for you next time you do go to the supermarket to just check that certain items of nutrients, etc., are in what you're buying, and I suppose you have a little bit more time to study them and a little bit more time to examine exactly what it is that you're putting into your body, lockdown or no lockdown. So I'm just going to talk, in a general way of about what's the importance of nutritional diet within dental health, within the dental health arena. Okay, so we are going to start with things like teeth. What are the importance of teeth? I mean, I often go to little people, schools and nurseries, and talk to them about teeth and diet and brushing and oral health. And I always start with the question, and the younger they are, the cuter it is to find out the answers. And I say to them, what are teeth for? What do you do with them? And I get all sorts of answers back. And then we start talking about the importance of different teeth and the importance of why we have different shaped teeth and what their roles are, and whether they think all teeth do the same thing or what. And yeah, very interesting answers that I get. The mention of Dracula is very frequent, I might add. But essentially, when it comes to teeth, the most important function, as far as we are concerned, us dentists, the most important function is chewing food, biting into food. I mean, our front teeth are there as biters. Our canine or eye teeth at the side are there to it literally tear tear food, and they're the most prominent teeth in canine animals like dogs, for example. And then, of course, the back teeth go more into the chewing function, and make sure that the bolus of food that you put into your mouth is chewed enough and broken down enough so that then you can swallow it successfully. So they all have this function, which we can summarize as the function of chewing. And here's an interesting fact that with people who have more than 25 teeth in their mouth, they tend to eat much more nutritionally than people without 25 teeth or more in their mouth. Not quite sure where I got that one from, but it's an interesting fact. And imagine no teeth. You wouldn't be able to chew any crunchy raw vegetables or anything like that. So really, we do need them to chew, unless you're going to be on a soup diet, which of course we sadly do experience with certain elderly people, especially advanced elderly people, when they do start to lose their teeth, or they have problems with dentures, which luckily we don't experience as many dentures as we did back in the day when I qualified over 20 years ago. We used to have a lot more elderly people who used to have full dentures, i.e. no teeth. Very, very rarely see that now. But the problem with people who have no teeth or very few teeth is that their ability to chew really diminishes. And also that they have a lack of taste, because of course you might have a lump of plastic sitting on the roof of your mouth, and and also blocking parts of your tongue. So these are the areas within your mouth that you have the taste sensation. And if these areas are blocked or almost prohibited, then your sense of taste goes down. But chewing is definitely impacted, and therefore they tend to start eating more soft food diets, and soups and mashed up foods, very much like babies or toddlers do. So when they don't have as many teeth. So I think the longer we can keep our teeth, the healthier that we can keep our teeth, the more we can keep eating those raw vegetables, and of course biting into steak, etc. So So I'm going to start with dental distress. Now, it's pretty obvious, but if we don't take care of our teeth and gums, then we risk tooth decay and gum disease. And even an advanced form of gum disease leads to bone loss within our dental bone, the bone in which the teeth sit. So you have the progression of something called gum disease, which I'll talk about in a minute. But if the gum disease progresses and it's unchecked and it's left to develop, then that can affect the tissues around the actual tooth, around the roots, and it can cause severe gum disease, and it can lead to bone loss or periodontal bone loss or periodontitis, which is the extreme form. And sometimes this is genetic, sometimes it's age-related, but either way, if you hear those terms knocking about next time you come and see us, then it's something that we need to take a little bit seriously and address. And that's something that we need your help to address, because what we do in the surgery or in the practice, we might see you once every 6 months or every 3 months or even every month. But what you do at home twice a day, hopefully, is far more important than anything that we do. So we need your help to let us help you. All right. But before we talk about that, we're going to talk a little bit about cavities. So cavities, as you know, it's a hole. A cavity is a hole. It can be a small hole that just sits in our enamel, which is the top surface of our tooth, the protective surface of our tooth. If the cavity develops further than the enamel, it goes into the dentine. Now, the dentine is the layer underneath the enamel, and the dentine is the layer that's sensitive. So, for example, certain calls I'm getting at the moment are, I think something's come out because I'm feeling very sensitive, or I don't know why I'm feeling pain to cold, to ice. A lot of people are now taking ice because of the weather, it's improving, and they're complaining of cold sensitivity. And when I ask them to examine their tooth in the mirror, or in fact, I had a case like this yesterday. They didn't know they had a cavity. And then I asked them to look in the mirror. And identify with their tongue, go all across the surfaces of their tongue and check if there was anything slightly missing or slightly sharp. And funnily enough, in this tooth, it wouldn't be a classical cavity, a pit in the middle of the tooth, but when they rubbed their tongue across the back of a back molar, they could see and feel slight sharpness. And that was because a cusp, part of the cusp, which is the sort of the mountain in the tooth at the back, had come away or broken away with something that some nut or something that they had eaten. And as a result, it was a little bit sharp, but they hadn't noticed that before. All they noticed was a bit of sensitivity. So when we brought their focus into that actual area, we could see that a little bit of tooth had chipped away. And obviously the bit that had chipped away was into their dentine, which is sensitive. Because it's made up of a series of dentinal tubules, which allow the hot and cold straight down to the nerve and hence cause the sensitivity. So they then realized that it was a chip in the tooth, which what we call, when you come to us, it's essentially a cavity. It's a hole that we need to fill. So whether it's a pit, or whether it's a mountain, or whether it's a physical little hole in the tooth, to us, that's a cavity. Now, funnily enough, another statistic, up to 90% of school children and the majority of adults have at least one cavity. Now, I'd like to think that with time, with technology, with education, that statistic is going down, but it's still quite a high statistic. And yeah, so we need to, if you ever want to see what a dental or oral cavity, a cavity looks like within a tooth, just Google images of dental decay or dental cavities, and that is not a pretty sight. And hopefully, especially when you look at things that are untreated cavities, that is something that's awful. I remember doing a little bit of charity work a few years ago back in Myanmar. And it was just the things that we saw. We were working in an orphanage, and when we saw the children coming in, I mean, their whole mouths, they just had stumps in their mouths, not teeth. They were black. There was decay everywhere. It was heartbreaking, to be honest, because we couldn't just fill them as we would here. We couldn't just fill them with a drill. We literally had to go around the mouth and extract all the teeth because they were just beyond repair. And that is really heartbreaking, and something that I've never seen in this country and I never want to see again. So we must take them seriously. They might start off small, but we need to eradicate them and we need to prevent them. Like anything, prevention is better than cure. So what happens with cavities is they result from the buildup of plaque, which, as most of you know, it's a slimy substance that is sticky and it's composed mostly of bacteria. Now, in breaking down sugar and carbohydrates, the bacteria create acids, okay? And these acids can eat away at the teeth. And that is something which, as I mentioned to you last week, is something that I'm most scared about when I advise people on brushing their teeth, because they've had a sugary meal or a meal that gets broken down into sugars. Then it attacks the teeth at night. And if they forget to brush their teeth or they don't brush their teeth at night, these acids are then eating away at the teeth all through the night when their saliva function, as I mentioned, their saliva function is heavily reduced because it's sleeping. And these bacteria have carte blanche to just attack all night. So I always give advice that at night, well, twice a day, but definitely at night, we must do our best to keep things as clean as possible before we go to bed. So cavities may start off pretty, they're very dangerous because they're quite silent when they start, and often people don't realize, and therefore the importance of checkups is really there, because certainly at certain checkups, especially if we take certain x-rays, we can see hidden decay, a decay that perhaps you don't know, you can't see, you can't feel, but we can see it. And the best time to pick that up is when we are just doing a regular checkup and you've got no problems, because then we can deal with this either through diet or through cleaning habits or actual intervention, but it'll be minimal intervention, which will more or less be painless. And if the cavity is very small, we might not even need to give you anesthetic or an injection. And that's the best case scenario, because we've got rid of the problem before it even affects you. But if they're left unchecked, and if, let's say, if there is a cavity forming and you haven't been to the dentist for, I don't know, a few years, and you come in pain, for the first time. It's usually Christmas Eve, actually, but in my experience. But if you come in pain, that's often a stage where it's too late to do anything minimal. It's obviously got down past your enamel, the cavity. It's got into your dentine, and sometimes it's even worse. It's got very close to your pulp, which is where the nerve center is of your tooth. And that's when things start getting a little bit hairy, because you either end up doing a deep filling, which again, I got another call last week actually from a gentleman who had had quite a deep filling done a few weeks ago. And he didn't realize that actually what was happening was drilling close to the nerve meant that the nerve inside the tooth was very irritated by this drilling. And obviously the drilling was there because there was a cavity. But as a result of that, he was experiencing a lot of pain after having the filling done. And that was because the nerve was reacting to this heat generated through the drilling, this aerosol generating technique. And what was happening was his nerve, reversibly, thankfully, at that point, was playing up saying, ow, that really hurts, I need to be calmed down. Okay, so in other words, when cavities get bigger and they get closer to the nerve, and they can hurt. So if they're not checked, if they're not treated early or prevented, even better, then they will hurt. And an untreated cavity, completely untreated, will develop and develop and develop, and eventually it will become a tooth abscess. So again, when we hear, again, I'm hearing a lot of this now, tooth, the people are saying, I've got this big lump next to my tooth and it was hurting before, or it was a filling, or it was a cavity, but it's no longer the cavity that's hurting. I've got this big lump and it's got white stuff in it, and it's basically pus filled, and that's an abscess, because what's happened is that the decay has gone through the layers of the tooth. It's gone from the enamel to the dentine, and eventually it's got into the pulp, which is where the nerve sits. And that then sparks off a series of events that leads to, through the gum, an abscess or a ball of pus, which then needs addressing pretty urgently. And there are ways of dealing with that. That's for another day. So, in other words, in short, if you get any kind of cavity or any kind of toothache or any kind of twinge, get treatment fast. Now, periodontal disease. So another fact, about half of British adults over the age of 30 have some form of periodontal or gum disease. It's a bit frightening. Gingivitis, or inflammation of the gum tissue, is an early stage problem, but with proper care, you can reverse it. If, however, you don't, eventually the inflammation leads to pockets or little spaces between the teeth and gums. And bacteria love to colonize these pockets, which can lead to periodontitis, or the permanent destruction of the tissues that connect the teeth to the bone in the mouth. Now, this is not good. Certainly when you get to periodontitis, it's not good. And we need to address it relatively urgently. Now, one of the things you probably notice when you come to the dental practice, we use an instrument, a probe, which has got, you probably don't notice, but it's got stripes on it. And we poke around your gums, and we sort of do a six pocket little chart where we start here and we read a number that might be 2, it might be 1, it might be 3, or it might be a lot more. But we go around and we give 3 readings at the bottom, 3 readings at the top, and that is measuring the pockets within your gums. And most of the time it's within a reasonable number and an acceptable number, but on occasion when it isn't, then we start to get a little bit we want to build up a treatment plan for you, which includes maybe referring you to the periodontist, definitely referring you to the hygienist, to get things cleaned, to get things moving in a way where we can try and bring those numbers right down to 0 in an ideal world. Now, very few people have 0, but even a 1 is good. 1 just means a little bit of bleeding when we touch them, but that's not the end of the world. It's when the numbers are a lot higher that we start to worry. Now, why do we worry about gum disease or periodontal disease? So, it's localized, and it's just an inflammation in the gums, and maybe a bit of destruction of tissue within the mouth. So what? What's the big deal? Well, it is actually quite a big deal, because periodontal disease is a risk factor for coronary artery disease, i.e. within the heart. We don't really know for sure, but apparently gum disease doesn't just signal inflammation, it also increases inflammation. And inflammation contributes to coronary artery disease. Plus, So, in other words, it's the gums are, affected, but the harmful bacteria can enter the bloodstream through the gums more easily, and they can lead to other chronic health problems, like, for example, this coronary artery disease. And interestingly, another fact, the same bacteria that colonize our gums have also been found in arterial plaque wall. So, in other words, there is a link between heart-related issues and gum disease. And also, it's very important during pregnancy to have your gums in check and to make sure that the gum disease is kept in check, because again, it can lead to complications within pregnancy and birth. So it's something that we really need to make sure that we keep a check on. In fact, most of the time you'll find dentists are more touchier about your gums than they are of your teeth, because for us, the gums are the foundation stones of your teeth. If the gums or the foundations are rotten or they're less than perfect, then we can't expect the bricks and mortar to stay up. So the first thing we always want to do is we want to check your gums. We want to make sure that the inflammation is brought down, that we are treating your gum health, then we address your teeth. Always there's that pattern. If somebody comes in and says, I want to have veneers all across my teeth, or I want to have my teeth whitened, or I want to have all this cosmetic treatment done, not a problem. We love doing that because the results we see are so rewarding. However, if we were to build on dicey foundations, for want of a better word, then we're not doing ourselves any favors, because whatever we build will crumble. And therefore, we really need to do things in the proper ethical way. And it all starts with your gums. So going back to the gums, or the mucosal cells, or the cells in your mouth, funnily enough, our cells turn over within 3 to 7 days. So nutrient shortfalls or excesses will show up in the mouth tissue before they show up anywhere else. So therefore, another good reason for when you get your teeth checked is that we can pick up certain abnormalities or deficiencies, for example, anemia, also certain more important or rather serious things can be picked up in the mouth, for example, oral cancer. So when we ask you, for example, to lift your tongue up to the roof of your mouth, and we're prodding around in the mouth, or we're prodding around at the top, we're feeling for any lumps and bumps, we're looking for any abnormalities of color, we're looking for things like that, where, because of this cell turnover, which is pretty fast in the mouth, we can pick up deficiencies a lot quicker than perhaps even doctors can elsewhere in the body. So now periodontal disease is associated with low blood levels of vitamins and minerals, and getting enough of specific nutrients can be important to successful treatment. So it's not just what we do. As I mentioned earlier, a much larger part of how we can help you is through what you can do. And that's not just oral hygiene techniques, that's just what you put into your body as well. So what you need for healthy teeth and gums, here's a handy cheat sheet, as it were. And what we can do for those of you who are interested is we can get this cheat sheet and one or two of the other cheat sheets emailed over to you, should you want one or need one. It's just useful and handy to have, especially at the moment where you can study it a little bit more. So there are certain nutrients which are really helpful for specifically tooth-related growth and development. For example, protein. So protein is really important in tooth structure. It's very important in the mucosal and connective tissue development, and also for your immunity. And as we know, immunity is a buzzword at the moment. We really need to be boosting our immunity to help us ward off the coronavirus. The more immunely robust, if that's a word, the more robust we are with our immune system, and hopefully the fewer or no underlying health conditions, the more we are armed to deal with things like the coronavirus or any other virus, to be fair. So after protein, we have calcium. Now, calcium is extremely important, as I'm sure you know, for tooth structure, for bone structure as well, but going back to the teeth, for tooth structure, it also may enhance the enamel remineralization. Now, what does remineralization do? Well, enamel, you can look at the enamel, it's the top surface of the tooth, and you can almost look at it as our protective guard, or our overcoat that we need to just protect the underlying dentine, which is the sensitive one with the tubules, and it transports heat and cold straight to our nerve. So the enamel, it's really important that we try and strengthen our enamel. Now, a lot of people lose enamel through grinding their teeth as well, or through excess toothbrush wear. And so our attitude always is to bring back this enamel or to re-mineralize it, because through overbrushing or tooth wear or grinding, you demineralize your enamel, or rather do that more chemically with certain acids and certain foods, or you just mechanically remove it through tooth wear. But either way, if we can re-mineralize the enamel through things like calcium, through milk, for example, then that's helping to strengthen the powerful protection around the teeth. Phosphorus is another one. And so phosphorus and calcium and zinc, they all help with the mucosal connective tissue and the immune function. And things like antioxidants, again, similar, and folate and iron, they all help with the connective tissue and the immune function. Folate in particular, low levels of it will be associated with periodontal disease. Then you've got other things like vitamins A and C, and they all help with mucosal connective tissue and immune function. So the thing with these is, with the vitamins, is sometimes if you get excess, then that can also have an effect on your gums as well. So it's really key to get a real balance of these vitamins. And omega-3 fats, they actually modulate your immune inflammatory response. And B vitamins, they help with your epithelial cell turnover, so your cell turnover rate at the lowest form. So again, these vitamins and minerals are really key in helping within the oral cavity. So a list of nutrients is all very well, but when you're standing in the grocery aisle, especially as that's kind of the highlight of certainly my week at the moment, standing in this grocery aisle, you actually need to know what actual food to buy. So it's all very well, these nutrients, but what foods do I buy that will include these nutrients in them? Luckily, you don't have to have anything majorly special. You don't have to look at too much fine detail. If you eat mostly a whole food diet with lots of lean protein and fresh vegetables, avoiding mostly processed foods, especially that are high in simple sugars, and you take your fish oil, then we're pretty much good to go. Actually, it might sound easier rather than easier to say rather than do, but certainly at the moment, when time's on our side, I know a lot of people that I've been speaking to are investing in allotments, and they're trying to grow their own food at the moment. A, it's something to do, and B, it means that their foods are pretty much whole, and also organic and just much better for them all round. So it's something to consider. Now, what if you're a class SWAT, and what if you want to get bonus marks? So we've discussed all of these things. You're in the grocery and you're in the relevant aisles getting all these whole foods. But if you just want to get bonus points and really be very good, then you would look for things like probiotics, which they help to decrease gingivitis or gum disease and plaque. And probiotics obviously in yogurt, and you can get certain supplements. Then you've got cranberries and other plant foods which are rich in anthocyanins, such as blueberries, red cabbage, aubergine peel, black rice, and raspberries. They also help with, well, they basically prevent the attachment and colonization of baddies on host tissues. So in other words, they are, again, your fighters. So really good to have other things like these berries and red cabbage, etc. And then, of course, there's green tea. Now, polyphenols, like there are in green tea, have been known to reduce bacteria in the mouth. Now, tea also tends to be rich in fluoride, possibly the most well-known tooth strengthener. Now, many of you will say and hear us talking about green teas and herbal teas and the slight acidic effect of the fruit in the teas, or the green tea being a stainer of teeth. Yes, I mean, these are all true, but if we look at the benefit, we always have to weigh up cost benefit. And the benefit of green tea is that it reduces bacteria in the mouth. So at the moment, that's really important. The staining element is of relatively little importance compared to the benefit. Then you have soy. So a diet that includes soy may help to reduce periodontal disease. Arginine is an important amino acid, and it alters the oral pH, or it increases the alkalinity or reduces the acidity of the mouth or the oral cavity, and hence reduces the chance of oral cavities developing because of that eating away action of the acid. Then you've got coenzyme Q10. It's a similar substance to a vitamin, and deficiencies in coenzyme Q10 may play a role in the development of periodontal disease. So for whole foods first, you get all the nutrients you need, more or less, from whole foods. Also, the bonus is that you give your teeth and gums a workout with all that chewing, and therefore you need good teeth to do that. Now, unless you have a known deficiency, then really you shouldn't be needing supplements, to be fair. Now, keep in mind, however, if you are a chronic dieter, then deficiencies are almost more likely to happen. So you must check with your doctor, depending on which other either deficiencies or any habit-related deficiencies that you might develop. Just be careful. Fluoride. Now, fluoride is a mineral that helps to prevent decalcification in our bodies. In other words, it helps our bodies to absorb and use calcium very effectively. So we hear about fluoride, and there's all these controversial debates about fluoride versus no fluoride. Today, I'm obviously talking about the benefits of fluoride. Again, we're looking at the cost benefit of things, but people seem to think it's all about the teeth, but it is really helping our body to absorb calcium more effectively. It also acts topically on teeth to promote their surface health. Fluoride in the saliva may also help to promote remineralization of enamel. In fact, getting enough fluoride is more important than reducing sugar when it comes to preventing cavities. Don't worry, I won't tell you kids. But fluoride is also important. Again, some of the calls I'm getting are based around sensitivity of the teeth. So one of the things I'm suggesting is that you get your normal toothpaste, whatever it might be, and rub it, especially if it's high in fluoride, rub the toothpaste on your tooth surfaces at night time, the last thing you do after you've brushed your teeth, and leave the fluoride there. What then happens is that overnight you get this slight remineralization, and you do that every day. It'll really help with the sensitivity, because you're remineralizing the enamel and hence strengthening the armor around this dentine, which is so sensitive. So that's that bit there. So now let's talk about how much is too much and what kind. Now, added sugars appear worse for teeth than naturally occurring sugars. And naturally occurring sugars would be things that are in fruit, for example. The World Health Organization suggests that no more than 10% of total energy intake should come from added sugars. So if you ate 2,000 calories per day, that would be 200 calories of added sugar, or 50 grams. So other things like sweeteners. Now, artificial sweeteners, again, this is not the place to talk about other sweeteners, but things like Splenda or sucralose and aspartame, for example, in equal, they don't seem to promote periodontal disease or cavities. And sugar alcohols such as xylitol don't seem to influence oral health. Actually, chewing gum containing sugar, alcohol, xylitol after meals may even decrease your risk of forming cavities. So chewing a bit of gum for 20 minutes. Now, I know, again, there is controversy around xylitol and sweeteners, etc. And again, that's not the scope of what we're talking about today, but we're just simply talking about the effects of chewing on saliva production when you chew, and therefore the additional protection when it comes to the acid attack that may be occurring to affect the cavities in your mouth. So therefore chewing does help with that. So more or less in summary form, sorry, that was a postman. I'm very grateful the postman is still coming. Thank you. So the recommendations on what we've more or less been speaking about, and also from last week, are to brush your teeth, not only brushing your teeth, but also obviously flossing and mouthwash, as we recommended last time. Avoid smoking. Smoking is a big area we need to worry about when it comes to periodontal and gum health. Smoking actually destroys the very bone that your teeth sits in. If we look at a big scan of your teeth of a smoker versus a non-smoker, a lot of the bone, especially a heavy smoker, a lot of the bone has been destroyed in that of a smoker versus not. So smoking is a real big and it can wreak havoc on your gum and tooth health. So because it also increases what we call plaque retention factors. So it sort of, it sits on your teeth and attracts more plaque and more bacteria, and then can cause decay that way as well. It also dries your mouth. Which a dry mouth isn't very good, because again, the saliva is what washes your teeth and washes all the acid away. And if there's dryness there, that doesn't help with cavity production, and definitely not with your gums. Drinking green tea, yeah, as we mentioned, it improves the health of your teeth and gums as it decreases inflammation, makes your mouth more alkaline, affects the pH of your mouth, and inhibits the growth of cavity-causing bacteria. Which prevents tooth loss and may slow the progression of oral cancer, and freshens the breath by killing odor-causing bacteria. Wow. And all this, and it can also help you to lose fat. So green tea is a big tick. Well, for today's talk, it's a big tick. So, and then chewing, as we mentioned, it increases the saliva production and prevents the bacteria in your mouth from producing the acids that cause cavities. But of course, the most important thing is to eat whole, nutrient-dense foods that provide plenty of calcium, phosphorus, magnesium, vitamin K, especially K2, vitamin D, foods like leafy green vegetables, nuts, seeds, hard-aged cheeses, nice, plain yogurt, meats, beans, mushrooms, fish, eggs, and organic meats all work here too. And you've got to get some sunlight. Luckily, we've got sunlight. Well, maybe not today, but we've been getting a lot of sunlight. And so getting your arms and legs out and face, obviously careful with face, in this sunshine is really, really handy for that good old vitamin D. To get into your bones and eventually to your teeth. And raw vegetables. Yeah, raw vegetables, as we mentioned, they also end up being the natural toothbrush for you. For example, carrots are always the natural toothbrush for us. There's a lot of chewing going on, and not to mention the fiber benefits of raw fruit, and to include the skins of things like apples and carrots, etc. Eating an apple as dessert after lunch will help to remove material that has adhered to the surface of your teeth. Plus, apples also contain the naturally occurring xylitol. And you just limit the number of sugars that you have. It's very easy, as I've mentioned before, at the moment, especially with your children, you're thinking of 3 meals a day, and I'm sure between meals, they want to snack and they'll reach for the chocolate cupboard, or they'll reach for the biscuit cupboard. Really important to give them as much colourful and healthy alternative to the chocolate cupboard. And you might just cut your vegetables or your fruits, in a pretty arrangement and give them to them. You might add some hummus to the carrots or the sweet peppers. Again, something which will be a filler for them, but will also be a very healthy alternative to sweet or to added sugars. Increase the amount of arginine in your diet. Eat more spinach, lentils, nuts, eggs, whole grains, meat, seafood, and soy. And of course, getting regular exercise. Thankfully, in this country, we're still allowed to do exercise. So whilst you are staying at home, take advantage of that once a day that you can get out and exercise, get some fresh air and get your heart pumping. It's so important that, and even for us, exercise seems to protect against periodontal disease, which is a bonus. But we must not abuse, but use this privilege, because so many people in so many countries aren't even allowed to step out of their flats or their houses. So we really, really need to value that freedom we have, and use it for our benefit, for our health, and also for our gums and for our teeth. So yes, based on all of that, I think I will end today's talk. If you have any questions, of course, you're more than welcome to give us a shout or on email. We will be sending you a link. If any of you would like any of the cheat sheet details that I have mentioned earlier today, then please do ask for them, as I've got them all noted. And in the meantime, have a very safe week. Enjoy yourselves and stay safe, stay at home. And hopefully next week we will get some information as to when this whole thing is going to be soon to end. All right, take care. Thank you.